Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Amy Dinaburg. She's a retired emergency department nurse. Today's Kevin MD article is Lowercase PTSD, Why Emergency Staff Are Still Hypervigilant. Amy, welcome to the show.
Well, thank you so much for having me.
All right, so tell us briefly a little bit about yourself and then what led you to write this article on Kevin MD.
My name is Amy Dinaburg, and I'm an a retired ER nurse. Before that, I was a scientist in research and development. I have a master's degree in molecular biology and clinical nurse leadership.
Okay, so you wrote this Kevin MD article, Lowercase PTSD, Why Emergency Staff Are Still Hypervigilant. What led you to contribute this article? And then tell us about the article itself for those who didn't get a chance to read it.
I recently was seeing a therapist, and he suggested I may have PTSD. And I initially rolled my eyes because I've never been in a war. My parents didn't show their love with violence. I didn't really think that I could have PTSD from working at my job as an ER nurse during the pandemic. Also, in the culture of ER nursing, we're tough. We can do anything. We can just throw it at us and we will make it work. So when he said, sort of reframed it as lowercase PTSD, as being consistently exposed to all the death and the uncertainty and the fear, different policy changing day to day. And it was easier for me to swallow and think about, because initially I thought, there's no way I have PTSD. So that's what made me write about, think about it, process it, and then write about it. So that's what started it.
In the article, you make the distinction between capital T trauma and lowercase PTSD. Tell us more about that distinction.
Well, I was thinking that capital T trauma would be a catastrophic event, whereas the lowercase, it was more day to day, things becoming normal that weren't normal and just readjusting. And when you are exposed to, somebody's dying or, somebody's intubated or just the chaos of the ER on a day-to-day basis, and you can't process those emotions because the next ambulance is coming in, the next person dying is coming in. You just have to keep rolling with it. And there was no real decompression time. And of course, I don't want to get into, the hospital system and, just a short-staffed issue. I am just talking about what we did have to deal with on a regular, everyday basis that just became normal for us. And it's really hard to turn that off when, even after the crisis is over. It's been years since that crisis, but those coping mechanisms that kept us alive during that pandemic, they don't automatically turn off when the crisis ends.
Give us some examples of some of those coping mechanisms that you're mentioning, especially during the pandemic, now that you've had some time to reflect on that.
I'm always looking for where the fire is that I have to put out. It's very hard for me to sit and just play with Legos with my kids without thinking about, okay, this needs to be done and this needs to be done and this needs to be done, and we need to be ready for this. And sitting and being silent and still is a challenge. I've had to relearn how to do that. And it wasn't until I retired that I realized that I'm still doing it. I am not working anymore. And yet I still have that way of thinking still happens.
And what were you like before the pandemic, before becoming an emergency department nurse? Were you always like this, or is it just the events from the pandemic and a job that changed you?
It's a good question. I feel like I've always been interested, or I've always loved to, jump in the mix and be a team player and make things happen. But before the pandemic and that whole event, I could sit and be with myself and be silent and quiet. I may have been bored. I also feel like I had more compassion for, little things. You have a stomach ache? Oh, Whereas more like now, it's like, are you dying? Like,
Hmm.
but that might just be with just emergency nursing in general. However, I feel like just the intolerance for people not doing what they're supposed to be doing, because in the ER, if we're not all a functioning, I feel like every single one of us was an organelle in a really high functioning cell, and when anybody slacks, we can pick up the slack a little bit, but if somebody doesn't, do what they're supposed to do on a regular basis, the whole team suffers. Now, I've brought that home with me,
Hmm.
where if my children aren't running like a high functioning trauma bay, I might lose my patience a lot faster than I used to. I used to have more patience and curiosity, whereas after the pandemic, it looked like sort of competence, being competent without the inability to soften. Just very, it has to be done this way. You have to make it, even things like when the kids don't put their shoes where they're supposed to go, it's not just a minor irritant. It can be destabilizing
Hmm.
for this lowercase PTSD idea.
Now you left the field of emergency department nursing. What were some of the reasons behind that? Was it because a little bit of this lowercase PTSD?
Yes, I love nursing, love it. Well, really, I love helping people. I love being in contact with people, being there for them in their most vulnerable moments and helping them find peace or stability or what they need. I feel like I would like to, my goal now is to get into the more spiritual side of patient care and treating the whole person rather than making sure they just survive, if you want to know what I mean.
So when the therapist said that you had PTSD and you had time to reflect on it and think about it, tell me what happened next in terms of how you dealt with that and how that has affected your life today.
It's been really illuminating. One of the other things as a nurse that you have to do regularly is justify why you do what you do. And when you're in a situation where your resources are so thin and there's no way that you can be on time for 60 patients in the lobby, making sure that they all get medicated, because I mean, that's what it was like. You either had 4 patients in a zone who were all actively trying to die, or you had the lobby, which was or the triage area, where you had 60 patients who were triaged as not critical, but it could all turn on a dime and it was up to you. So when your resources are so thin, you have to be able to make sure that your priorities are correct and that you're doing what you're supposed to be doing for the people who are the sickest, but also take care of everybody else too.
Mm.
So with that mentality of always trying to justify why I was doing what I was doing, I found that in the processing of, do I have this PTSD? Am I carrying these coping skills into my life today? When the pandemic was years ago, I realized I'm constantly justifying everything that I'm doing because I'm afraid somebody's going to tell me I'm doing it wrong.
Mm.
And that has been just like, I don't have to fight anymore. Like, sort of, I don't have to like, one of the other things besides that thought habit that I'm working on is being able to rest even when I feel like I don't deserve it. Just before I feel like if I needed to rest, I would just rest. But now I have to earn it. I have to make sure that I'm a part of the team and I do my fair share before I can earn the privilege of resting. And so that's another thing that I've realized since this diagnosis of PTSD is just being able to rest, not having to fight to make sure everyone knows that I did the right thing, being able to sit, learning, recalibrating my nervous system so I can sit still and be silent and think about, it's not an emergency. I don't have to make a decision right this second. I can think about something for an afternoon
Mm.
before making a decision, because before it had to be done and it had to be done right now, or it had to be done yesterday. But I guess we can get it done right now. So does that answer your question as so far as how my life has sort of changed since that diagnosis? It's really illuminated a lot of the behaviors that were coping skills that I needed at the time, but are not serving me in the kitchen of my house. You know what I mean?
So there are thousands of healthcare workers, of course, that are still working even after the pandemic. What are some of the dangers if we don't address this potential PTSD that they had because of the pandemic? What are some of the repercussions to these healthcare workers?
Disillusionment, of course, burnout. But I feel like burnout also needs to be reframed as well, because I was in burnout for sure. But I feel like when you are really entrenched in that burnout, you know you're burned out and you don't care. It's just life.
Mm.
And so when people offer you resources or you should do this to help with your burnout, you just have accepted your fate. And you don't think really anything could help. And if it does, it would help for a second. And it's hard to describe now that I'm on the other side of it. So I feel like, especially people on the front line, but also people, the ICUs or people who really see critical patients on a regular basis, and their resources are spread so thin. I just feel like more needs to be done to address healthcare workers so that they keep the joy in, their heart and their passion in helping these folks who are sick and being there for them. Because towards the end, it was just like, are you dying? No? Okay, next. And that's not where I began.
Mm-hmm.
I love connecting with people and helping them up and, and serving. And where it ended was, if you're not dying, I need to move on to the next person who is. Even with my children, I mean, not completely, but instead of being present with them, always wondering what more important needs to be done.
What kind of advice do you have for your fellow emergency department nurses or other healthcare workers for that matter who may be listening to you and wondering whether they have undiagnosed PTSD? Tell us the advice that you have for them.
Go to a therapist and discuss it. Just discuss it. Have a conversation. You may not, and that's okay too. But also anyone who goes through, a whole event like that that lasted for years with all the, political implications and your neighbors and people wearing masks and Facebook and, all these things coming from all different angles. I did have a patient one time who's like, I don't believe in COVID, as I'm putting the nasal cannula, on his face. And so any sort of event like that is going to leave a mark. So even if you don't have, PTSD officially, lowercase or uppercase, there's decompression that needs to get done. And that's honoring your humanity. Mm-hmm. It's not admitting weakness, which is one of the things that I was afraid of. Like, I'm weak we're tough broads in the ER. So just have a conversation. And if you find yourself being unable to be silent or unable to be present in moments that make life worth living, sit down and talk with a professional about it. It doesn't have to be a big deal, just have a conversation.
We're talking to Amy Dinaburg. She's a retired emergency department nurse. Today's Kevin MD article is Lowercase PTSD, Why Emergency Staff Are Still Hypervigilant. Amy, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Take-home messages. The coping mechanisms that kept us alive during the pandemic don't automatically turn off when the crisis ends. Our nervous system, our physiology has changed after prolonged exposure to that sort of environment. And so turning around and being the person that you were, it's hard to do. So be cognizant of that. Think about that and see if there's help that you can find or conversations that you can have that would help others mention too that they're suffering some sorts of things. I would just really just recommend anybody on the front line just to have conversations about how they're feeling right now, pre-pandemic and post-pandemic, and see if there's any help that they need in finding peace.
Amy, thank you so much for sharing your story time and insight. Thanks again for coming on the show.
Thank you so much.